Welcome to the Pain and Brain Healing Center's Functional Medicine website. Hello, I'm Dr. Greg Force, author of the bestseller, Why We Hurt on Chronic Pain and Fatigue, and clinic director here at the Pain and Brain Healing Center. Now, possibly you found your way here online because you are frustrated and confused. Frustrated and confused because you or loved one is suffering from a chronic illness, chronic pain and fatigue. Perhaps you're worried and concerned because you've been told that you're going to have to live with this condition the rest of your life, or to live on drugs the rest of your life. Maybe you're tired of the medical merry-go-round, going from doctor to doctor, tired of taking different drugs for each symptom, and then having to take drugs for the symptoms that those drugs cause. Possibly you're just sick and tired of being sick and tired. I want you to know that this website has been made specifically for you. If you're suffering from any of the conditions listed below on the home page here, I want you to know that we have had phenomenal success with individuals who suffer from these chronic conditions. I want you to know that you no longer have to suffer. What is life for? I believe we are here to experience the beauty in living, and this is important. However, this becomes quite impossible when you suffer from chronic illness, pain, and fatigue. Now, to rid yourself of this chronic pain and fatigue and illness, you must get to the underlying causes and then properly treat them. Now, we accomplish that here at this clinic because we treat the individual, not the label. Labels are for boxes, not for humans. We don't treat symptoms, we get to the underlying metabolic and nutritional cause of your chronic illness, pain, and fatigue. We leave no stone unturned. Now, when we get to the underlying metabolic issues, we treat them properly to help rehabilitate you. Now, individuals come to this clinic and to this website at different points along their journey to restoring their health. Some have been to many doctors, have done extensive research on their condition. Others are just beginning and are totally lost and confused. I want you to know that wherever you are on this journey, we can help you from the very beginning steps of improving your diet to sophisticated lab testings, even for chronic infections such as Lyme disease. Now, to understand how we decode the mystery of your chronic illness, let's look at the analogy of an iceberg. Now, I just drew this here. This represents an iceberg, and if we look, we'll see that at the top, above the waves, is your symptoms: chronic pain, fatigue, insomnia, anxiety, flu-like symptoms, aches and pains, depression, weight gain, GI problems. This is what people come into me for. The number one reason anyone goes to see any doctor is pain and fatigue. Now, that's not the problem. And if we chip away at this with drugs, treat the symptoms, we can leave behind the underlying aspect that is the most dangerous component for your ship of health, if you follow my analogy. Now, what causes these symptoms is something called chronic inflammation and oxidative stress in your tissues. It's like you had a pot on the stove and you turned it on simmer. That chronic inflammation starts to wear away at tissues and function. Now, what is causing this chronic inflammation, systemic inflammation, and oxidative stress are these issues that must be addressed. Diet is huge. Maldigestion, malabsorption. If you're not absorbing the micronutrients, the vitamins, minerals, or the macronutrients for energy to build your tissues, proteins, you're going to end up with chronic issues. And nutritional deficiencies and insufficiencies. If we're not digesting, if we're not absorbing properly, we're going to get nutritional deficiencies. If we're eating food, a SAD diet, a standard American diet, we're going to get nutritional deficiencies. Or insufficiencies because of genetic demands. We're all genetically different. Then there's dysbiosis and leaky gut. Dysbiosis is, maybe you've not heard that term before, it's imbalanced life, bad life. You have more bacteria in your GI tract than you have cells in your body. This bacteria is vital for living, and a healthy balance is important. When I test individuals, I see candida, bacteria that shouldn't be there, or not enough good bacteria. Now, when we have dysbiosis, that can lead to inflammation, irritation, and we can get a leaky gut. Maybe you've heard that term, maybe not. That's where we don't have good tight junctions in the small intestine, and we absorb macronutrients. We absorb macromolecules that we can react to, like an allergy. Now, food allergies and sensitivities, these many times develop from leaky gut. Those need to be identified and treated because those will ramp up inflammation. Allergies are very commonly a source of chronic inflammation in the body. Then there's insulin resistance and metabolic syndrome. This is huge. 40% of Americans today have insulin resistance and don't even know it. And this leads to diabetes. But it leads to something called metabolic syndrome with high triglycerides and cholesterol and all kinds of health problems. It's a major cause of chronic pain and chronic fatigue. And unless you are running the right tests, you don't know until you're diabetic. Then there's hormonal imbalances. And many of you are probably wondering about your thyroid and adrenal function. Those need to be addressed. They need to be diagnosed. And this leads to blood flow changes in tissues and mitochondrial dysfunction, which we will talk about. But all these factors need to be looked at, properly diagnosed with laboratory testing, and addressed to remove these symptoms. It does no good to just address the symptoms with drugs. Now, sometimes there's confounding issues, and some of you have been along the path looking for answers, may have found out or not found out that you are dealing with an autoimmune disorder. These are growing in our society because of the ongoing toxicity in our society. Hashimoto's is the primary cause of 70% of hypothyroidism today. Lupus, Sjogren's, RA, all these autoimmune disorders are growing. And that gets us to toxicity issues, chemicals and heavy metals. These plasticizers, we have food containers made of plastic that leach out phthalates and BPA, solvents, cleaning fluids, lead, mercury. All the patients I test with an ongoing chelation challenge, I find elevated lead and mercury and other. And this is big, because even today we're finding arsenic in organic rice as well as just plain commercial rice. If you're handling receipts, every time you handle receipts, you're getting BPA. I mean, our modern society is awash in toxicity issues. Then there is chronic infections. Our immune system may not be overcoming some of these chronic infections, and this can lead to chronic inflammation and cause a great deal of issues. One of the issues that are caused by all this is once we get inflammation, we get thicker blood, hypercoagulability, and this leads to poor blood perfusion, poor oxygenation, and if our tissues aren't getting enough oxygen, they're going to be fatigued, painful, and achy. So all these issues need to be looked at. Well, once they're identified, we have to go after them and treat them. And this is called my 3R approach. The first R is remove. We have to remove, we must identify and remove anything that's causing harm to your body. Poor dietary patterns, food allergy sensitivities, dysbiosis, bad bugs growing in the gut, candida, chemical toxicity, heavy metals, chronic infections. They need to be identified and removed so your body can start its true healing. Then the second R is that we have to identify and restore anything that is deficient. If we have nutrient deficiencies, insufficiencies, this is going to not allow you for your optimal health. So dietary changes to optimize nutrient levels, and then nutraceutical therapy, replacing nutrients that are deficient and low. So, and then the third R is repair. We need to activate, stimulate repair of your tissues and cellular function, optimizing that. And that's done through structural care, myofascial care, traditional acupuncture, laser therapy, brain-based therapy is huge. And there are articles on all this on our website and videos that you can look at if you have questions. We use biofeedback, heart math, brain AVE to help put you in a more healing state, a more theta dominant state where you are able to heal, to get the benefit of such like meditation. So there are ways that you can overcome your chronic illness, chronic pain, and fatigue. Now, I want you to know that this is something that you can do and can be accomplished. It's vital to you understand that the symptoms that you've been presenting to your doctor, this pain, fatigue, brain fog, flu-like symptoms, mood changes, anxiety, depression, gastrointestinal issues, GERD, IBS, are not the cause of your problem. It's the underlying metabolic issues that have to be addressed and no one is addressing. Again, there are numerous articles and videos on this website that help explain all these different issues, but you can also come in and we can discuss them. So for me to unravel the mystery of your chronic illness and apply this 3R program, I need to do a complete health history on you, do a comprehensive neurological and nutritional exam, and then run specific metabolic laboratory testing specific to your condition. I also need time to help you walk this journey back to optimal health. Health that you deserve. And if you have any questions, please call my clinic here at 763-862-7100. And while you're calling, you can set up yourself for a free consultation to get off this medical merry-go-round and start the road to healing. To qualify to do this, you just need to go on to New Patients on our website, hit New Patient Forms, print out the comprehensive biomedical history form, fill it out, and then bring it in with you, and we'll go over that together and any recent lab work you've had, and I'll let you know if you are someone that I know that I can help. So Please feel free to call us anytime if you have any questions or set up your free consultation. Again, I'm Dr. Greg Forrest, board-certified chiropractic neurologist, author of the bestseller Why We Hurt, and clinic director here at the Pain and Brain Healing Center. Thank you so much for listening. I hope this has been helpful for you, and I look forward to hearing from you in the near future.